if you looked at it kind of like a sports team, there were 31 times that low carb has won, 31 times that they've technically drawn, and then 0 times has low fat ever won. So, you're going to bet on the fact that low carb is going to win.
Welcome to the Fat Emperor podcast. I'm your host, Ivor Cummins. We're supported by the Irish Heart Disease Awareness Charity, which advocates a simple CT scan to reveal your CAC score. So, know your score and take action to prevent that premature heart attack. Everything you need to know will be right here. Today I'm talking to Sam Feltham, who's the head of Public Health Collaboration UK, or phcuk.org. So, great to see you again, Sam.
Always a pleasure, Ivor.
Indeed. And you know what I thought we'd start off with, because we'll get into the whole, let's say, struggles and endeavors to get better diets and dietary guidelines across the world. But first, I'd like to touch again on what we talked about a few years ago, your personal experimentation with lower carb and higher carb, and what kind of happened for you?
So it was, I can't believe it, it was actually like 2013 that this was. It's like 6 years ago now, but it's still fairly relevant, these self-experiments that I did. But I essentially overate by twice the amount of food that I usually do, so about 6,000 calories, just under. And on this first experiment where I was overeating by pretty much 3,000 calories a day, totaling 6,000 calories consumption a day. I did it for 3 weeks on a low carb real food diet. And over those 3 weeks, I gained only 1.3 kilograms, but actually lost 3 centimeters from my waist. But the calorie formula says that I should have gained 6.1 kilograms. So there's quite a discrepancy there. And kind of a lot of people kind of palmed it off as, you're one of these naturally lean athlete type guys and things like that. And I was like, okay, that in itself kind of disproves the pure calories in, calories out formula. But in order to reinforce this message, what I did is that I overate by the same amount, but on a low-fat fake food diet. So kind of, cereals and sandwiches and lasagnas and garlic bread and stuff like this, basically. All low-fat, of course. And on that, despite the fact that I overate by exactly the same amount of calories, just over 47,000 calorie surplus, which the calorie formula says it should be a 6.1 kilogram weight gain. I actually gained 7.1 kilograms during those 3 weeks. And kind of, with the blood markers and everything, my triglycerides quadrupled, my HDL went down by a third, and I'm trying to remember the other bits and bobs. Yeah, my glucose, of course, increased as well. Yeah, obviously, there's quite a discrepancy there, even though it's the same calorie surplus. And this is after the protein thermogenic effect, the loss from fiber, and exercise is exactly the same during all of these experiments. And there's a difference of 1.3 kilograms on a low carb diet weight gain and 7.1 kilograms on a low fat fake food diet. And then I did a third one just to kind of make sure that this kind of still fits in with the way that we're thinking about this. And so I did a very low fat vegan diet where I was eating, I think it was about 15% fat through that, which is kind of, that's the minimum intake that you should be having. And then, very, very high carb as well, about 70% carbohydrates. And this was all kind of, porridge, potatoes, pineapples, bananas, stuff like that, basically. And again, overate at 6,000 calories a day for 3 weeks. But this time, because of the sheer amount of fiber that I was eating, to put it in perspective, the recommended daily allowance is about 30 grams, I think they say now. that you should be having, apparently. But I was eating 175 grams a day, so I was losing a lot of this food, and on that I actually only overate by 40,000 calories, so 7,000 calories less. But over that period, I should have put on 5.2 kilograms. I actually gained 4.7 kilograms, so half a kilo shy of that. But still, even though it was less of a calorie surplus than the low carb diet, I still gained 3 times the amount of weight, basically. So kind of it's all over the shop in terms of the different foods that you're eating, even though the calorie surpluses are fairly similar. And that kind of gave me somewhat some notoriety in this space. Yeah, from there, it was kind of a case of setting up the public health collaboration.
Yeah, and I remember that was most striking. I think we were talking with David Unwin in the Royal College of General Practitioners, and you mentioned the HDL went down on the high carb and the triglycerides went way up. So I think the ratio changed by around 4 times or something. It was a massive change in that important ratio.
Oh, massively, yeah. I think kind of technically, I did have metabolic syndrome by the end of that second experiment. So that's pretty bad for a guy that's always been naturally lean and healthy, essentially.
But again, just reminding the audience that this was a pretty gross excess of calories. So it's a special kind of test, if you will. And yet the low carb, high fat, healthy diet with similar excess of calories didn't near put on the same weight and also didn't move the markers greatly.
No, not at all. Everything basically stayed the same on the low carb real food diet. My triglycerides were the same. HDL actually increased. And then the only thing that really changed for me, despite the fact kind of struggling to eat all of this food because I was very satiated throughout that entire process of that first experiment. On the second one, I could keep on eating, like with all of that food, it was crazy. On the low fat fake food, but the only thing that changed on the low carb real food was the fact that I felt like I had more energy. I still kept the exercise exactly the same throughout all of the experiments, but I felt like I had more energy. And there was actually one point about 3/4 of the way through that first experiment with the low carb real food diet where I had a night where I woke up sweating quite a bit. So like I felt like I was almost overheating a little bit. That was about it.
Yeah, no, it's a dramatic experiment, pushing things to the limits. And I think in general, and funny, this brings us on to public health collaboration because, everyone is different in their makeup. So people can suggest, yes, you're special in one way, but everyone does react differently. And even in the weight loss trials, we see some people losing 10 kilos in a year and another person only losing 1 kilo. So there is variability, but you pulled together, is it 62 or 63 very low carb versus low fat trials, RCTs, randomized control trials, and almost every one, the low carb always beat, even if it wasn't statistically significantly, always beat low fat. So that's the roll up of all the trials, yeah?
Yeah, so we've got this page on the website, which is phcuk.org/RCTs, where we've pulled all of the randomized controlled trials between low carb and low fat for weight loss as one of the outcomes. And there are 62 in total. 53 of those are greater in weight loss for low carb. 7 are greater in weight loss for low fat, and 2 of them are equal. But when you look at the statistically significant results of those, 0 are statistically significant for low fat, but 31 of the 53 are statistically significant for low carb. So if you were a betting man, you know where you'd put your money, because if you looked at it kind of like a sports team, there were 31 times that low carb has won, 31 times that they've technically drawn, and then 0 times has low fat ever won. So, you'd you're going to bet on the fact that low carb is going to win, essentially.
Yeah, for sure. And that is the published literature, and that's just the way it is. And I think even within those, sometimes they didn't go particularly low carb. Sometimes the low fat, there were some trials where it was ad lib for low carb, but low fat was calorie restricted. So even, and there are many other biases that creep into the trials, understandably, because the orthodoxy is looking for a particular result. But even with biases that sneak in, they just can't make the low fat win. And I think we just know why now, that the low carb is healthier, especially for a modern population where arguably the majority in the West are partially diabetic at this stage. The low carb becomes a no-brainer for those people.
Well, it's just logic, right? So, I mean, even in the NICE guidelines, so in the UK, NICE is the organisation that governs the guidelines that healthcare professionals have to follow. And in their guidelines, they describe diabetes as a disorder of carbohydrate metabolism. Yet later on, they go on to say that 50% of your diet should be carbohydrates, even though they've defined it as a disorder of carbohydrate metabolism. But when you do look at it just as a disorder of carbohydrate metabolism, it's a perfectly logical and reasonable step to restrict carbohydrates somewhat in order to treat that disorder. It's fairly logical.
Yeah, and I think Professor Volek made that point as well repeatedly. He said carbohydrate intolerance defines the metabolic syndrome. The metabolic syndrome, unsurprisingly, can be relieved by restricting carbohydrate. And that's what we see in every trial. And Virta's latest, trials are just stunning, with 90% or more coming off insulin. And I forget, there was 60% effectively reversing diabetes, though we know that people with serious type 2 diabetes have more of a remission than a reversal. They've still got metabolic damage, but by their markers, essentially reversed. So we're going to see a lot more. But public health collaboration, maybe you could talk a little around that, because I've seen that go from strength to strength, and it's only been created a couple of years ago, really, or well, maybe 3 or 4. And what I love about public health collaboration is it's a body that's stuffed with doctors, professors, and medical people at the board level. So, it's got all that credibility of some of the best doctors in the UK, which is a fantastic side to it. So maybe you'd give a summary of it.
Yeah, it was kind of an idea that I had at the end of 2015. So before I got into the public health collaboration, I was a personal trainer and I was running fitness boot camps. But at the end of 2015, I was just getting really annoyed by the number of people that were having to come to us, and we'd have to re-educate them on what it means to eat healthily and also move healthily as well. And I decided the only way that we're going to sort out this whole mess is by setting up a charity, a non-profit organisation that is going to focus everybody's energy in this space, organise it, structure it, and kind of, give the powers that be the solution that they need to sort out this mess. And they'll need some leading, because there are people within the government organisations that want to make the changes that we're talking about, but it's difficult to kind of, steer that ship when there are other powers that are pulling it at the heartstrings of those organisations. But we're here to kind of help that along, essentially. And it was in March 2016 that we set up, after an online crowdfunding campaign where we doubled our target. And as you say, we've got a scientific advisory board of doctors and researchers here in the UK that kind of essentially govern everything that we're doing. And I'm the director of that organisation, in order to kind of make sure it stays on the straight and narrow, and also does what it needs to do, because everybody that's on the advisory board is a volunteer. They volunteer their time to do this, and I'm the only full-time employee of the organisation. And so we've got fairly limited resources, but we've got so many great people involved with this organisation that allow it to do what it's trying to do. And for instance, this yesterday, Sunday, we actually ran our very first ambassadors conference, and our ambassadors are volunteers throughout the UK that liaise with healthcare professionals at a local level to inform them about the PHC and how we can help them. And we had 60 people in Birmingham, and we were kind of presenting on best practices as an ambassador, how to kind of get your foot in the door in a GP practice, and how to set up patient meetings and things like that. So yeah, there's lots going on with the PHC, but it's been an incredible journey.
Yeah, and you've got some big names in there as well. Obviously, Asim Malhotra, who's well known, I presume, to most listeners, but also Dr. David Unwin. And I think recently he's got real traction, even with the orthodox groups that might have been seen to be a little on the other side of the fence, like NICE or NICE. They have, I think, adopted his sugar diagram, like showing a slice of bread has 3 spoons and a potato has so many spoons. Is that? I think I saw that recently. They've adopted his sugar
Yeah, exactly.
chart.
So that's been a real big step forward for us. That actually happened like officially last Saturday, so a week Saturday, and yeah, his sugar infographics that put foods in terms of the equivalent of how a teaspoon of sugar reacts in the bloodstream. So as you were saying, it's about 3 eating a slice of bread is about the equivalent of eating 3 teaspoons of sugar in terms of your blood glucose response. And kind of when you put foods in that kind of context, and you have metabolic damage such as type 2 diabetes or metabolic syndrome, then that's important information to know. And as you say, recently NICE have finally endorsed those, and our link on the PHC website is now in the tools and resources for NICE type 2 diabetes guidelines, which is incredible. So PHC now does have a link to NICE, essentially, which is a massive step forward because it kind of means that we can go to healthcare professionals and say, look, our sugar infographics are now NICE endorsed, and nobody's going to bat an eyelid handing those out. So it's awesome.
Perfect. And it's such a useful tool, like you say, and we're seeing more and more the use of the glucose monitors, continuous ones, or even just the pinprick. And they are so useful for people with metabolic syndrome to find their particular nasty foods. And I know generally we know which are the bad ones, but there's quite a lot of variability in individuals as well as to which the worst carbs are for them personally. Interestingly, we just finished a documentary in Ireland with 50 of Ireland's top sports stars from the 90s, and we calcium scanned them, and we got some very high scores in there. 9 people out of 40 something had to get immediate follow-up, and they were all presumed to be healthy beforehand. But there was one person with a 1200 score who now has fully adopted everything we would espouse, and he has his glucose meter, and he's finding out that his blood glucose is going up to 8 or 9 millimoles with certain foods, and it's not even moving like with eggs, and he's completely living his life based on the meter. Interestingly, he said when he eats beetroot, which he liked in large amounts, he can go up and hit 10. I think it's very starchy actually, but by having your meter and David's chart, of course, between those two things, anyone can greatly reduce their risk of future coronary disease and everything else.
Yeah, it's a fairly simple measure that you can take on a personal level, is get a blood glucose monitor. I mean, obviously, ideally, it's a continuous blood glucose monitor, but it doesn't have to be really. As long as kind of you're tracking when you're eating certain foods, then yeah, it's going to be fine with a regular blood glucose monitor. But if everybody was given a blood glucose monitor and everybody was just eating to the meter, I think we all know what type of diet people are going to be ending up eating, essentially.
Absolutely. That's kind of like I think you mentioned earlier, in some ways there's a lot of just logic and common sense to this. So absolutely. And I think we're going to see more of that. So on public health collaboration then, one I was at, I don't know, was it the first conference a couple of years ago, myself and Dr. Gerber were speaking? That was maybe the second, was it? Or the first? Ah, the second. Well, it was absolutely fantastic vibe. I know I've been a bit busy recently, but there's one coming up again, this year's one, and you've even got Robert Lustig, I think, along.
Yeah, that's right. So on the 11th and 12th of May, we're holding our fourth annual conference at the Royal College of General Practitioners in London. And as you say, we've got Professor Robert Lustig coming over from San Francisco, but we've also got Tom Watson, MP, who's the deputy leader of the Labour Party over here, which is the largest political party in the UK. They're not currently in government, but they're basically kind of like, it's either Labour or Conservatives that are in power. And so, you know, potentially in the next general election, he'd be the Deputy Prime Minister. And the fact that he himself has had a transformation story through real food, and specifically low carb real food himself, he's managed to transform his health from living with type 2 diabetes to not living with type 2 diabetes. And I think he lost about 50 kilograms. So, you know, he lost an entire person, like for some people, which is incredible, from his body. And that was down to a low carb real food diet. And he wants to share that story at our conference. So it's going to be fantastic to host him. Amongst some other familiar faces you might have seen, such as Dr. Zoe Harcombe, PhD, who's talking about fibre, which is going to be very interesting. And also we've got Dr. Trudy Deacon, PhD, who's talking on the science of eating less, moving more, getting fatter, which is going to be very interesting. Yeah, and we've got poster presentations this year for the first time. We've got poster presentations kind of in the dinner hall that we've got. And we've got 11 of those on a range of subjects, which are going to be fantastic. So lots of things going on. So if anybody wants to come along, then they can check it out on the website, which is phcuk.org/conference.
Hey guys, just a quick break to remind you that this podcast is only possible due to funding from the Irish Heart Disease Awareness Charity and its founder, David Bobbitt. David discovered he had massive heart disease in 2012 and could only do so by getting a 5-minute calcification scan and CAC score. It enabled him to take action to stop the disease process and to save his own life. Now he is spending millions to help others do likewise. All we ask is to help get the message out on the power of CAC, watch the Widowmaker movie linked at the end of this podcast, and share it as widely as you can. Thank you, and now we return to the conversation. Yeah, it's super stuff. And Tom Watson, indeed, he's an excellent high-level advocate for the proper healthy way of eating. I dropped over to, I met you there actually in the House of Parliament, where Tom gave a fantastic, impassioned kind of talk for around 10 minutes. And of course, Asim and Zoe. And I got them all out on YouTube, so that was good. A lot of views, so the message is getting out there. The PHC then, I guess it might be a bit premature, but there's some moves afoot to get similar organizations around the world. I think PHC Australia has already come out, so to speak.
Yes. Yeah. We've got lots of things in the works in terms of international chapters, and Australia have launched already, so that's fantastic. But yeah, hoping in the coming months that we're going to have lots of movement in terms of that. So everybody watch this space on Twitter. I'm sure you'll hear about it.
Yeah, I know it's going to be excellent. That's what's really needed, is many countries all with a similar structure kind of joined at the head, and it'll be very interesting to see how that can accelerate the transformation to real food and get rid of this fake food problem.
I hope so. And kind of the idea of the PHC is to try and bring some consistency to what we're all saying, essentially, and kind of have this one organisation that's recognisable throughout the world, where people go, okay, yeah, they're the people that are actually starting to make sense. Because obviously there's a problem. because public health across the world is getting worse and worse, despite kind of as much money as public health organisations, government public health organisations, are pumping into it. It's just getting worse, and so yeah, it's high time that we sort it out, essentially.
And things like, I mean, the starches, refined carbs, and sugars are getting more acceptance as being problematic because it's common sense. I think an interesting one will be to have a unified voice on industrial seed oils and vegetable oils, because that one's pretty tricky. Most of the world's health bodies believe not only are they not a problem, but they're still advocating eating them for your heart health. And we know that the data is highly questionable around that. In fact, in Denver a couple of weeks ago, I moderated a debate between Dariush Mozaffarian, who's a top Tufts professor and, epidemiologist extraordinaire, and Gary Taubes. And Dariush made the point, or Dari as he's called, that actually we share a lot in common. He believes in lower carb for a modern population. He believes that the fat thing was grossly exaggerated and the fats are not so bad. But the major difference that surprised the 800 plus in the audience was he still pushed vegetable oils and canola oil. And that seems to be a big difference, even with the more progressive people on, let's say, the other side.
Yeah, definitely. That does seem to still be a sticking point, and that'll be the next hurdle for us, is to try and get, mainstream acceptance that vegetable oils and kind of industrially processed oils, they just weren't a good idea. It's fairly simple. Like, natural fats is where it's at.
And to your own point, I mean, I think it was you who primarily started that term fake food. And I love it because it kind of epitomizes our problem. The overwhelming majority in the supermarket now of foods all around the center are kind of fake foods because they have industrial vegetable oils in them, refined carbs, sugars, all the cheapest, highest margin ingredients that we know the science says is a serious problem. So fake food, I like that one.
It was the idea, before we get on to the next question, was that it's about trying to make common sense of this crazy environment that we've created, essentially. And so, I wish we could just call real food food, because it's just food. But the stuff that we've made over the past 50 years is the fake stuff, the stuff that's kind of come out of the factories and things like that. So trying to create this concept for the public to reframe what is out there, that this stuff is the real food, and this stuff that's kind of just only been sold for the past 50 years is the fake stuff, so that then they can wrap their heads around this quite easily, was the idea behind that.
Another one I used it at a talk at a big event the other day, but made similar points. But if everything you eat, especially if you have heart disease or a high calcium score and you're at very high risk, everything you eat, just ask yourself the question, would my great-grandfather, great-grandmother, would this have been a food that would have been normal then? And that question alone can help you separate out. If you're looking at a bowl of breakfast cereal, the answer is no. If you're looking at vegetable oils, obviously not. Processed foods. So it's another way to check. There was something else I wanted to ask you. Yeah, one thing that always amuses me, though it's not funny, it's tragic, that a huge amount of effort went in over 40 or 50 years since the McGovern Commission to find natural real foods to be culpable for modern diseases, which was absurd, because to blame a modern disease epidemic on a ancient food is insane. But they put a lot of effort in, and we still see studies on eggs, meat, and all the real foods. But what we don't see, really, in 40 years, is a trial of classic processed food against real food. No one's done the trial to look at the thing that almost obviously is a source of problem, but they've done myriad trials on real foods to try and find them to be bad. Isn't that fascinating?
It is. We're in a complete topsy-turvy world, I guess, is kind of the way to put it. I'm sure there were some well-meaning people out there, maybe, but then there were also some dark forces that kind of leaned into that as well. So yeah, it's a terrible situation that we're in, but I'm hoping that the public health collaboration will be a large part of actually rewriting history in terms of getting us right back on track, really, in terms of helping the public see that the emperor isn't wearing any clothes. you know
Yeah, that's one of my favorites for sure, obviously. The Emperor. And PHC, I think, especially when it branches out worldwide, is going to be huge. I always figured that. We've got Nina Teicholz and the Nutrition Coalition in the east coast of the USA, and they're probably aiming more at policy level on Washington, perhaps. But how long do you think that we largely have gotten the world to get to grips with some of the basics of what we're saying, as in a majority accept what's generally bad food and what's good food, and that exercise does not overcome a bad diet? Do you think it's going to take a decade or more, or what's your thoughts?
I think we will make significant progress by 2030, like significant, and kind of get a lot of mainstream acceptance. I think there'll still maybe be a bit of resistance still in 10 years to some of the ideas of what we're saying. But I think largely that would have been accepted by then. We'll still be battling. I think probably the sticking point really is the saturated fat issue. I think trying to get them to completely reverse their guidelines on that is going to be a massive undertaking. If it happens by 2030, I will be very surprised. And well, I'll be very pleased as well. I hope it does happen. But if they kind of reverse their position within the next 10 years, yeah, that'd be incredible, really. But the large acceptance of a low carb real food diet, I think, will come into effect in the next 10 years, certainly, and have it as one of the standard options that patients can choose from when they're diagnosed, and in follow-up appointments, for instance, when you're living with type 2 diabetes or pre-diabetes or type 1 diabetes as well. Because we've still got a little bit of way to go on type 1 diabetes and kind of getting that accepted, even though it makes even more sense when you look at the biology of type 1 diabetes. And then, then the sticking issue will be saturated fat, I think, and the LDL thing, even though however many times that you debunk it over, which is fantastic, and please keep doing it because we need more and more of that. But that's going to be the sticking point, I think.
Yeah, the LDL is the many-headed hydra. You can chop off heads all over the place. You can even chop all the heads off, and they just pop back up again. But the saturated fat, I agree, that's a sticking point. And I think what will happen is, even a couple of years ago, actually, the guidelines, there was initial publication from the guidelines committee, and they had the quote that saturated fat is no longer a nutrient of concern. And that kind of snuck out, and I used it in our book, Eat Rich, Live Long. But the reality was there was strong lobbying, and that kind of comment was removed before the final version. So I agree, it's a real sticking point. And I think I get quite a few people who write to me, with calcification scores that have continued increasing and their markers don't look so great, and they're on really hardcore low carb keto, guzzling fat. And I always remind them that just because saturated fat is broadly not a problem for the community and actually is much better than other fats for many conditions, it doesn't mean that everyone can gorge on it. I mean, you got to look at your blood markers. But yeah, the general guideline for people, most people, certainly replacing it with vegetable oils is crazy. Fake foods. Yeah, for
not
sure.
Not a good idea, not at all. So yeah, our 9 words of wisdom at the public health collaboration are: eat real food, avoid fake food, be active every day. Hopefully that will come into effect in the next decade.
Excellent. The conference is on May the
11th and 12th.
11th and 12th of May in London in the Royal College of General Practitioners.
That's the one. It's an amazing venue, and actually on the Saturday evening, I didn't mention earlier, we do have an evening dinner up on the in the staterooms at the top floor of the RCGP, and before everybody goes into the stateroom, we're out on the roof terrace, kind of overlooking London and everything. So if you want to come to a fantastic networking event, that's the place to be.
Yeah, and it's pretty much gathering together some of the best medical professionals in the whole of the UK in one place. So, and you get to hobnob, fraternize, and go up on the roof and look over London. I mean, what could be better?
It's fantastic. So more the merrier, definitely.
Excellent. Well, any other last thoughts, or will we wrap it at that? We'll be talking again soon anyway.
Yeah, definitely. I mean, the last thing is that after the conference, we've got two events actually that are going on. The first one in June is Real Food Day, and the idea of that is that it's an awareness day that highlights the power of real food on lifestyle diseases. So the idea is to try and make a bit of a noise through the media about, you know, the power that real food does have on lifestyle diseases such as type 2 diabetes, but on all sorts of diseases as well, not necessarily lifestyle diseases, but epilepsy for one, and trying to get that out through the media more and more, and just to try and encourage more and more people to eat real food and avoid fake food and be active every day. So if you want to get involved in that, people can go to realfoodday.org, and you can subscribe there. Everything's free and everything. So please do check it out. And then in July, we've got our first Real Food Rocks Festival, which is in the north of England. And it's a day of real food, real music, and real fun. So if people want to check that out, it's realfoodrocks.co.uk.
Yeah, that sounds a bit like the Keto Fest in the US with Keto Dudes.
It's on exactly the same day, and we're actually trying to work out if we can kind of do a bit of a video link between the two festivals, because that would be great, kind of, you know, across the Atlantic, that we have, the Keto Fest going on. I think it's in Connecticut, is it, or New Hampshire? And then, ours in the Lake District, you know, that'd be fantastic. To kind of the fact that they're going on the same day is brilliant.
Ah, that's perfect. Well, I'm pretty sure I'll be over in Keto Fest anyway. The other event Jen Unwin told me about and asked would I go, but I'm in either Switzerland or Stockholm. There's a couple of diabetes and cardio conferences, so I'm kind of going to miss out in the UK side this year, but not to worry. There's going to be many more years, all right?
Definitely. We'd love to have you next year, Ivor, for sure.
Great stuff. Well, listen, thanks a lot for that, Sam, now, and I hope you're right, and I think you're largely right. In the next decade, there's going to be big changes.
Definitely, I hope so. Fingers crossed. And as long as we focus and keep on pushing the envelope, then we'll get there.
Yep, and the only thing missing from PHC currently is more advocacy for the calcium score, of course. But
of course, we're on it. We'll get on that for sure. One step at a time.
Good man. Thanks a lot, Sam. Till next time.
Thanks, Ivor.
Thanks for tuning in, guys. If you're watching on YouTube, you can see my subscribe button in the middle of the screen, a free viewing of the Widowmaker movie on the far right, and myself and Dr. Gerber's book, Eat Rich, Live Long, on the left. Otherwise, please do subscribe to the audio podcast. Thanks.